Here with retired Major Anthony Hassan, Clinical Associate Professor and Director of the Center for Research and Innovation on Veterans and Military Families at the USC School of Social Work, discussing mental health care in the military and the shooting at Fort Hood. Professor Hassan, you were deployed as a combat stress control officer. In your experience, in what way are mental health care providers in the military typically screened for mental health problems of their own?
I don't know if there's anything different for mental health providers in terms of screening them for their own mental health problems. I do know that as a mental health officer in the military, we are constantly under supervision, peer review. It's always available to us. And other than the typical kind of screening questions that you get, we really aren't screened specifically or separately or in any other way. But because we're in the mental health field, our colleagues are able to easily pick up on challenges we might have, difficulties we might have, relationship building challenges that we might experience. But in terms of screening us any differently for mental health, I don't think that's something that we do.
Is there stigma associated with mental health care workers seeking treatment, and how do you go about combating that?
Yeah, I think inherent in the job are some hazards of working in mental health. Hazards in working in mental health meaning that sometimes we are affected by what we hear, not to a degree that may be debilitating, but we are affected. And I think it would be a challenge for me mentally to go get mental health care. It would probably be very difficult for me to reach out, seeing as that I'm a mental health provider. So I don't know if it's stigma more so than it is feeling of being able to manage your own life affairs when you can help, when you're supposed to help, or you reach out and help others. So I think it's a real challenge for the mental health provider, for most mental health providers that I've worked with in the military to reach out and ask for help. However, I do know that a number of my own staff, both enlisted and officers, have asked me for a referral to an off-base mental health provider so they can get help to manage their care. And when they did that, or when I became aware of their challenges and they wanted to get help, we reduced their caseload, we provided them extra support, and we'd allow them to get mental health care from a civilian provider, not within our medical group, if you would. So I think the avenues are there for support. It's on an individual basis if they're really going to reach out and get the help. And like I said, personally, it might be a little bit more difficult for me to reach out and get help. And maybe I will rationalize and minimize the things I'm going through. But I think professionally, I would need to reach out and get the help I need in order to do my job effectively.
Do you think that enough attention is paid to issues of alienation associated with being an ethnic or religious minority in the military?
I think there's a lot of attention paid to diversity in the military. I'm not sure that everyone is culturally competent. I think we hear about it, well, when I was in, we would hear about it, we would respect it. I think sometimes we at times may not speak out because we don't want to offend. And I don't think that's the intention of the military, but I think that's how I think we interpret that sometimes. Like, well, how do I address this? And I don't want it to come across wrong, but there's a problem here, and maybe it's cultural, but maybe it's not, and so I don't know how to go about this. And I think if people reach out to each other, reach out to their supervisors, ask for support and supervision, they can reach out and ask the question in a way that's sensitive, at the same time, important to address. And so I think there is a lot of conversation about diversity, but I think it's just a conversation. It's not a process. It's not a way of being, if you would. It's not embedded fully in the way we do business. I think we're aware of it. Well, when I was in, we were aware of it. We were sensitive to those issues, but I'm not sure we knew how to handle it all the time.
What's the military doing now to help survivors of this tragedy?
Just from my own experience, I know that sent a number of mental health professionals to the community, both uniformed and civilian, to support the mental health workers there, of course, and to support the population there with more of an outsider's kind of perspective, or without someone being emotionally tied to the incident or affected by the incident. As a matter of fact, one of our faculty members, Lieutenant Colonel Val Vincent Reyes, who's in the Army Reserve, social worker, was called up to go support the crisis response, if you would, to this terrible tragedy.
What are students learning at USC about mental health care in the military that could help them deal with situations like this?
I think here in our graduate program we offer 4 courses that are specifically designed for military, for social workers who work with active military reservists, veterans, and military families. So I think our efforts here are aligned perfectly with where we need to be in terms of serving this veteran and military population, military family population. So courses that we're ensuring that our mental health professionals and social work graduates have before they leave, if they're going on to work with veterans and military families, is to understand military culture, the way of life, and we believe that's critical in order to make a connection. The second the second course that we're offering is a course related to evidence-based practice for trauma, post-traumatic stress disorder, major depression. So we want to make sure that our graduates really are informed about the latest and greatest therapies out there to treat particularly veterans coming back from combat environments. Another course we have is one for related to military families. So really understanding the military family, the issues that go with deployment, redeployment, loss, grief, separation, divorce, those kind of challenges. And then the last course that we're looking at here and redoing is one about policy, politics, and advocacy, so that our social workers who graduate from our program really go out and understand that we need to make change at the policy level. We need to advocate for change at higher levels in order to really affect the individual veteran and their military families members. So I think the unique thing about our program is that we have a cadre of military folks, retired military folks who are leading the way, who are educators, and who really understand the culture and the needs of the veterans and military families. So I'm confident to say that those who graduate from our program here at USC in the School of Social Work will be prepared to meet the challenges of our veterans and military families.
Thank you very much.
Thank you.